I'm Chris Picton and I'm the South Australian Minister for Health and Wellbeing. Well, we know that prevention is better than cure, but as per most states and most health systems around the world, we spend a lot of money, time and effort on cure and not as much on prevention. And particularly as we're facing ageing of the population, increasing incidence of chronic disease across the community, we need to focus more on prevention and helping people stay healthy and avoid having to come to our hospital system. So what we've done in South Australia is we're bringing together all of the aspects of prevention work into a new agency. It's going to be an agency which is legislated, has independence around it, and a real focus on trying to prevent people at that public health end from ultimately having to face going to hospital or other health issues down the track as well. So they'll be able to focus on issues such as tobacco and vaping or alcohol use, but also our increasing incidence that we're seeing of obesity and those chronic diseases flowing from that, whether that be diabetes or cancer and so many others. All of those preventive health issues are on the table, as well as importantly as well, how we can better invest and deal with prevention in terms of mental health as well. And we know right across the world we're facing increasing incidence of mental health distress. The more that we can take action to prevent that from occurring, the better for everybody as well. We've been working together with researchers and health professionals in terms of the development of this new law. So we're delighted that Parliament, South Australian Parliament, has just passed this new law to set up Preventive Health SA as a new independent body. And when we were working on the development of that legislation, we brought together a panel of experts, including health professionals, but also including leading researchers here in South Australia, but also some national experts as well, to get their perspective and advice. We also went out publicly and consulted and got the feedback of experts here and around the country on how we can best develop that legislation. So that's been set up in terms of how we legislated, but ongoing as well, part of Preventive Health SA would be to having a Preventive Health Council that will be made up of experts as well. They'll be providing advice to the organisation, of course to me as well, on how we can best take action in terms of prevention, because we want to make sure that that's as evidence-based as possible and it is going to make an impact ultimately at the end of the day.
I'm Marina Boschel, Chief Executive for Preventive Health SA. We're a brand new prevention agency in South Australia, and our focus is on primordial and primary prevention and looking at how we can keep South Australians healthy across generations into the future. We have a range of priorities. The government has asked us to look specifically at tobacco and vaping prevalence in the community, alcohol and other drug use, mental health and wellbeing, suicide prevention, and also obesity prevention, looking at food systems and the environments in which are creating an obesogenic environment, but also physical activity and how we can improve people's engagement in physical activity more broadly through the community. All of which, when you summarise them, are about really keeping people healthy, both mentally healthy and physically healthy, so that we know we've got a community that can flourish and be highly productive.
We want to see a big impact in terms of helping people stay healthier. And ultimately, the issue with prevention is always that the timeframes are really long. It takes a long time to see the impact of decisions that you're making. But if we don't start to make some of those big decisions around taking action on prevention, then things are just going to get worse and worse in coming decades. And so we need to do that now. I mean, one of the great things that's happened across the country in the past year has been action on prevention in terms of vaping. We saw this escalating out of control across the country and has been across the world as well. And Australia has really been taking action to say enough's enough and stamping out that vaping. And unfortunately, so many kids are getting addicted to nicotine. And here in South Australia, we saw a 1-year increase where it almost doubled the number of young people vaping in South Australia. So that's one example where we've already taken action. The other example is, we've been working on action in terms of prevention in relation to kids' impact from social media use as well. And that's something that South Australia has been leading on the national agenda, and we're delighted that that's now passed the federal parliament as well. And so they're just two different ways that prevention action has been happening that will have a long-term impact. But through establishing Preventive Health SA, through the work that it will undertake, we want to see more meaningful impacts, more policy changes that will lead to long-term benefits in terms of keeping our population healthy, reducing those incidents of non-communicable diseases, particularly things like diabetes and cancer in the future.
I'm Dr. Mary Bruce, and I'm currently serving as the President of the South Australian branch of the Public Health Association of Australia. Currently in South Australia, over half the adult population are living with one chronic disease and a quarter are living with 2 or more chronic health conditions. Now, that rate has actually been increasing over time, placing an ever-growing burden on our hospital systems. But what we know is that many of these chronic health conditions can actually be preventable. So by using health promotion practices and prevention practices, we can actually see improvements in the health and wellbeing and stop people developing chronic disease before they even begin. What we also know is that prevention is actually cost saving for society. So the recent estimates suggest that for every $1 spent on prevention, we're seeing a $14 saving on healthcare and other costs. Nationally in Australia, we're spending over $38 billion on chronic health conditions, but less than approximately 2% is only spent on prevention. And so we're really here at PHA advocating for an increase in that spend nationally. But what we're really pleased to see is here in South Australia, the government take prevention and public health really seriously.
As an agency, we're very evidence informed and we collect an enormous amount of data to make sure we're putting the resources we have to the best available effort. So when we look at where we prioritise our time and effort, we really need to focus on a couple of key factors. One is overall population health. So what's the burden of disease? Where do we see the greatest likelihood of impact from our interventions? So in that regard, obviously tobacco and vaping, as well as reducing obesity in the community, are likely to have the biggest impact on chronic disease and non-communicable disease burden in the community. But equally, we're interested in health equity. We realise not all populations share the same outcomes and get the same benefit from those wide population health levers. So we've got a strong focus on determinants of health and a strong focus on Aboriginal health and health equity, and that will focus on what we're hearing from those communities who are experiencing those health issues and how we can best support them. So again, tobacco and vaping and looking at obesity may be part of that, but also in a determinants of health model, we may be looking at factors such as strengthening cultural determinants within Aboriginal communities in partnership with the Aboriginal community controlled sector. Or it may be we're looking at how we can support food security for those populations who have low SES and food insecurity at the moment.
The Public Health Association of Australia has always been a huge advocate for prevention. And so in the lead up to the last state election, one of our key election priorities was around encouraging the governments to have an increased focus and spending on public health and prevention. We did that in partnership with the South Australian Public Health Consortium, which was made up of the South Australian branches of the Health Promotion Association of Australia and SACOS. And what was really fantastic was that at an election forum that was actually hosted by the consortium, the now Minister for Health and Wellbeing, Chris Picton, actually pledged that if his government was successful in being elected, that they would establish an independent preventative health agency. And so we've been very pleased to see the SA Preventive Health Bill tabled into Parliament this year, and to see the establishment of Preventive Health SA. All of this would not have been possible without years of advocacy by Public Health Australia members and the broader public health community as well.
The Wellbeing Index was created a couple of years ago after discussions with academics, non-government and government agencies, and looking at the international and national literature on what would be the best indices to measure not just physical health and wellbeing, but mental health, looking at what we can do in the determinants of health space, social connection and social health. And we're building at the moment a module around Aboriginal health, more specifically for cultural determinants of health. And the intention behind the index is to really look at the maximum level of impact. So we recognise we may have an impact in reducing smoking rates, which is of course a positive thing. But we also need to look at what is the reason that some behaviours are more prevalent in the community than others. What is the housing stability? What is the economic impact of certain levers? How can we go about making sure we're reducing discrimination, for example, or improving educational attainment, because we know those factors are so important to health and wellbeing more broadly in the community. The index therefore was formed to create a matrix of data that we can look at to see, well, how is the state's health being moved, either positively or negatively in those directions, and how does that help inform a whole of government response, not just the health system, but a whole range of government agencies that can then move different levers to improve the health of the community. We'll continue to evolve the index, and we're in discussions with a range of government agencies on how we can continue to grow the data or improve the data collection so that it can inform their action as well, so we can all have a health and all policies approach across the state.
We've been involved so far in having discussions about what evidence-based solutions look like to support public health and prevention across South Australia. We also fed back on the recent bill that was tabled into Parliament around the legislation, and we're really looking forward to just continuing that partnership moving forward and working together as much as possible with the new agency to ensure the health and wellbeing of our communities are improving over time.
We have a range of excellent universities and researchers in public health and clinical health and systems in this state, and we're fortunate to be able to draw upon their expertise to drive the agenda with us, because we know partnering in this space and drawing upon that expertise will be vital to success. So we're using data from our universities, from published literature, from the South Australian Health and Medical Research Institute, to not just drive and determine what our strategic directions are, but also evaluate our success in achieving the outcomes of those policies and programs. And we know that's complex in prevention. We know that sometimes you have a long lag time to see the maximum benefit. But we're confident there's some early measures we can also put in place to make sure we're on the right track. Just last night, the Preventive Health Bill was passed through the South Australian Parliament, and that requires us to set up an advisory council with expertise in data and evidence and epidemiology and public health. They will be assisting us in driving the evidence-based agenda forward. But in addition, the bill requires us to develop strategic directions, which will be setting not just our agenda for what we'll do, but how we'll measure the success of what we do. And that will be a public document so we can be accountable and transparent to the community.
I certainly would encourage any other state who's looking at taking further action of prevention to look at what we have done here in South Australia, and the Commonwealth Government for that matter as well. One of the things that we thought about in the development of this was actually over a decade ago, the federal parliament legislated for a national prevention organisation as well. Unfortunately, through changes of government, the Abbott government tore that up, and that never actually happened at a federal level. We're hopeful that the new CDC, the new organisation that Mark Butler is setting up, will not just focus on communicable diseases, but it will also focus on non-communicable diseases as well, and have a focus in terms of how we can take better action on prevention as well. So we're certainly willing and able to work across states and help them if they're wanting to look at what we've done here in South Australia. And likewise, we've also been looking at what other states have done as well. And one of the good examples is in Victoria. They've had an organisation called Vic Health that's been up and running for many decades there, providing great support. And the chair of Vic Health, who's former Federal Health Minister Nicola Roxon, she was actually involved in the development of our legislation here.